Good morning. Welcome to Organize, a webinar series on organizational capacity building. I'm your host, Leisha McKinley Beach. The Emory University Campus Coordinating Center created this monthly webinar series to share with a broader audience of Southern nonprofit professionals some key information on HIV and organizational development. These webinars were designed for the busy nonprofit professional on the go to get a quick training and some resources to help their organization function at its highest level. Each webinar will highlight one or more of the 8 core areas of our capacity building training. If after this webinar you feel you need a more in-depth training on this topic, please visit our website to request a one-on-one training. Now, today's webinar, how to support and address the needs and challenges of the rural South, will highlight a few strategies that CBOs, medical facilities, and other organizations can use to successfully address the needs of rural Southern communities. Did you know that 19.3% of the U.S. population resides in rural communities? That's estimated about 59.5 million people, with more than 95% of the U.S. land area being considered rural, according to the U.S. Census. Now, we have made great strides to reach the rural South and cater to its needs. Today, we want to take a moment and say thank you to some amazing champions who are working to address these needs and stand up for those communities which are oftentimes overlooked. Now, I'm truly honored and excited to be able to hear from 2 of those champions today, Ms. Linda Stringfellow and Ms. Desiree Dillion. First, we're going to hear from Ms. Stringfellow, who will share her personal experience of running a community-based organization in the rural South. Will you help me to receive Ms. Linda Stringfellow? Linda, it's all yours.
Good morning, everyone. I'm coming to you this morning from the Mississippi Delta, the land of catfish and cotton. And to tell you a little bit about myself, I have a couple of degrees. I have a degree from the University of Southern Mississippi, a degree from Delta State University, and a degree from Mississippi Valley State University. I'm the executive director with Fabric Incorporated, based in Cleveland, Mississippi, and we serve the entire Mississippi Delta. And I'm also the regional vice president for Together for Hope, where we serve the 6 states of the entire lower Mississippi River Delta region. Next slide. Okay, when you hear about the Mississippi Delta region, the first thing that comes to individuals' mind is extreme poverty, farming. A lot of that is correct, but there are other things that we want people to know about the Delta region. The Delta region, when we talk about rural South, that is 6 states. You see them on the screen: Arkansas, Illinois, Kentucky, Louisiana, Mississippi, Missouri, and Tennessee. And there are a total of 301 counties of rural poverty between those 6 states. And we are expecting those number of counties to change once the 2020 census takes place, because the census determines what counties are considered rural poverty. The information that you see on the screen, the population, that is for Mississippi only. And we see that 2,986,530 individuals live in the state of Mississippi, but basically more than half, a little over half, is in the rural area of the state. 59.1% are Caucasian and 37.8% are African American. But however, in your rural areas, majority of the population is African American, people of color. The per capita income is $36,636. But in rural areas, it has $34,181. However, we do have some families living off of an average income of about $19,000 annually. About 12% lack health insurance, and the rural poverty rate is 23.1%. And we have 19.6% lacking completing their high school diploma or GED. When we talk about the Delta region, of course, we know when a lot of individuals write for funding and they talk about the Mississippi Delta, it is considered the second poorest congressional district. The Delta region is agriculture, and it is considered rich. You hear people talk about the Delta is rich. They're talking about the soil. The Delta is known for the value of the land. And if you look at the photograph in the picture, the Mississippi River is the blue line, the silhouette of the man. That's how we learned it in school. But you'll notice all of the gray areas, those are the 301 counties. And all of that land is considered rich because it aligns the river. And that's how people make the living, because the Delta is an agriculture area. One of the things I always ask people to remember when they think about the Delta is, remember, he who owns the land runs the economy. Next. Some of the needs that over time that we've really looked at when it comes to many of our services is the lack of transportation. We look at, when we talk about lack of transportation, not just individuals do not have cars, because we do have some rural areas that have transportation systems. No, not a large bus, but smaller cab and transportation systems, and some through community action agencies. But when we talk about lack of transportation, it is the distance from the individual's home to get to the facilities that provide the services that are needed, and even to get to places such as a grocery store or even to go shopping. Yes, we have a lot of Walmart and Walgreens, but they are still not in some of the rural communities. But what is popping up are our Dollar Generals have started taking advantage of the rural spaces. Some of the funding restrictions, issues that we have pertaining to, or the needs pertaining to funding restrictions, the funding usually goes to the same grantees, the same organizations, especially in rural spaces. And some of our organizations want to pursue funding, but at the same time, they're not able to because they do not have the capacity to handle the funding. They may be an organization that may have one or two staff that does not have the expertise to be able to handle the funds. The other thing pertaining to funding restrictions, in the rural areas, we're still lacking the basic, the 101s pertaining to healthcare, health conditions, health disparities, whatever title that we give them. We're still missing the basics. During the time pertaining to funding, we've gone through a series of, we used to be able to spend a lot of emphasis and time on prevention, but funding restrictions stop us from doing that now. They want us to go into cascades of care and I would just say other services, and it prevents us from doing a lot of prevention education. So that's when we talk about restrictions, the funder now really sets the pace on some of the services that we are able to do, unless we get funding from other sources that allow what one funder does not allow us to do. With the stigma and traditions, the needs pertaining to stigma and tradition, when we're talking about HIV and other health conditions, we've done a wonderful job with separating ourselves from a lot of things when it comes to services. And we are noticing that some of the things that we have done over time has not eliminated the stigma. It has actually increased some of the stigma. When we want to provide service to address needs pertaining to the stigma, we have individuals that choose not to attend or not to show up because a certain label is attached to the name of the event, the activity, or the service that we are providing. And also when we look at a need and tradition, we are in an area, the rural South, where what family says and how we usually do it has more value than new methods and concepts that are being introduced to us. And as we had to learn over time is we have, when we talk about tradition, tradition is related to a relationship, some type of personal tie or value on that level. But then when we started talking about new concepts, new methods, it's moving our populations away from a connection with a relationship which has a value, whether it's the person or the entity or the church, and you're separating us or having us to pull from that relationship and go more to a independent or go off to another grouping with another individual. And I hope I'm painting this picture clearly. When we look at the needs pertaining to socioeconomic factors, of course, we always know the income. We talk about the environment, the area. We talk about housing conditions. We talk about the level of education. That's academic and non-academic education. All of those factors are still a major part of the foundation when we talk about the needs that we really need to address pertaining to this region and our access to resources. All of that is a huge part of it. With the medical mistrust, we're seeing two sides to the medical mistrust. There's a need for us to have medical providers that we can truly talk to. We're in an area where we have had medical providers to come in over the years, and they come in to do their 3 years because they get a huge, $50,000 or more of their student loan expunged or taken away because they come to rural areas and work for 3 years, and after the 3 years they are gone. So now we have populations that are saying, okay, are our medical providers truly trustworthy? Are they here to really help us? Or are they here to get their student loan debt canceled, or a big, huge percentage of their student loan debt canceled? So we're needing more genuine medical providers. The other part that we're seeing pertaining to need with medical mistrust is individuals that work at CBOs and ASOs and clinics that they're not trustworthy. We are in small communities. Everyone know everyone. What did they say, 6 degrees of separation? I think in rural areas we are 3 degrees of separation, and people being confidential with who comes into the organization, and even situations of people that have the role and responsibility of getting populations to services, but they've had personal encounters with the individuals that is supposed to be teaching them or helping them get into care and services. So we have it's like an onion. When we peel one section back, we see another layer that we want to address when it comes to our needs. Next. Okay, challenges. I believe I blended some of our challenges in with some of our needs, but once again, our access to quality and affordable care. We have clinics, and at the same time, we do have some clinics that do not provide a full services. I would say in the Delta, I'm in Bolivar County, which Cleveland is the main place, but the clinic that does provide services pertaining to HIV is in Mount Bayou, which is 15 miles north here. And then we have one in Greenville, and we have one in Greenwood, and we have one in Clarksdale. But think about all of the smaller towns that are in the area in between those areas, which is about a 20-30 minute drive between each one. And the other thing is with our local health departments, because of their funding cuts, a lot of our health departments are not open 8 to 5 Monday through Friday. Some health departments may be open 2 to 3 days a week, only for 4 hours in some of the smaller towns. And some of our smaller towns do not have a health department nor a clinic. So we're dealing with a lot pertaining to them being able to actually get to a facility for any type of healthcare needs. And we have a strong track record in the Delta of using the emergency room as our healthcare provider, our main healthcare provider. A lot of people use the emergency room as that. And so we do have a lot of pushback from hospitals with the emergency room being used as basically the PCP for some people. Some of our other challenges, like I mentioned, is the basics, the one-on-one pertaining to knowing your basic information pertaining to any health condition, as well as being able to offer or host activities or events or sessions to be able to teach our communities about proper getting into care and proper care and prevention. Our impact versus numbers. The challenges we have run across is we have a lot of our CBOs, ASOs, and even clinics that are reporting numbers. We distribute this number of condoms, or we had this number of people to come into our workshops or our sessions or attended our health fairs. That's great, but at the same time, what impact are you making? Are they retaining the information? Are they using the information? Is it helping them change and look at, okay, I'm going to do better pertaining to my day-to-day health. I'm going to make my doctor's appointments. So we are strong in reporting numbers, but we still have a way to go pertaining to really looking at the impact, and not only just providing services to individuals or have them to attend our sessions or activities one time, but tracking them, having a follow through 3 months, 6 months, a year out, to see if the individual, if what we're doing is making a true impact. And also pertaining to data collection. That's a part of that, how we collecting our data. What are we using the data for? And is it just a report to continue to get funding, or is it truly to make a difference in the lives of individuals? Same thing with our medical providers. I guess the sentence I can say behind that is, how do you educate the educated? Getting our medical providers to have refreshers on the up-to-date technology, what is new, what's working, what is not working. Also building a better rapport with the individuals that come to your organization in your facility. We have experiences where we have several medical providers. They know all that they know. There's nothing else that they need to know. I'm the professional, I'm the MD, or I'm the nurse practitioner. So I know that all I need to know. But some of the approaches that are being taken are some of the old approaches, and things have been updated. You know, we are in the 21st century, and we do have practitioners that are still practicing in the 20th century. The other challenge is looking at the whole individual, the holistic approach. We're in an area where we're still addressing one thing at a time instead of looking at the whole individual, the whole situation, and everything that's going on. And even a lot of our organizations are not looking at that approach, because they're focusing on how the funder says that they can do what they need to do. So funders, they're not finding funders that support viewing the holistic approach. So that prevents a lot of things. And then a lot of our organizations, funding is not diversified. And so it's, I want to do this, but the funder only allows me to do this. So they stray away from the things that really could work to really help individuals, families, and communities, and they stick with exactly what the funder says that they can do. But the holistic approach is really needed, but it is a big challenge to get us to operate in looking at the bigger picture and the whole individual. Next. Okay, for my major encounters, of course, for us personally, has been funding, territories, and incentives. With our funding, of course, with this being a small, new nonprofit that has been in existence about 3 years, our capacity to be able to get large funding, we have our official 501c3, but the staff is limited. And so our funding, us being able to get funding, so we partner with other organizations to still be able to do the services that make an impact in the communities and with individuals and families. And at the same time, we have Emory University and others that are working with us to help strengthen our capacity so we can and will stand strong individually as a nonprofit of itself. When we talk about territories, we are territorial here. If our organization has an event and we want to partner with some other organizations, some of the first questions we get is, who's going to report the numbers? Who's going to be able to report the numbers? And we don't focus on the numbers because we want to focus on the need. What's important is, what are the needs that need to be met, and not trying to count numbers. And if we go into, I'm based in Bolivar County, which is Cleveland, Mississippi, but if we want to go into other areas, the first thing we have to do is we have to take it through a dating process. We have to start looking to see what other organizations are doing the same things that we would like to do, or could work with us and to enhance what we're doing and enhance what they're doing. And we come together and sit down and start having meetings to build strong partnerships before we even go into those areas, because we want all of our partners, we have to make sure that they understand this is not a competition, it is a collaboration, and we're not focusing on numbers, we're here to meet needs. And if we can bring people in, and you all have people to bring in, all of our people can participate and learn together, and that will help them with a need that they're wanting and needing met. So we're very territorial. And then we do have some organizations, quote, quote, that has a monopoly on particular areas and pertaining to particular topics. And we cannot go into those communities whatsoever because some of the bigger funded organizations have agreements with the entire community. And so no one else can come in and do workshops, events, activities, or even collect data. So that's what I mean by our encounters. And we are very territorial in this area. When we look at incentives, I hope I'm not going too fast. When we look at incentives, I'm sure incentives about pertaining to a major encounter is a strange topic to see, but I will say this. When we talk about incentives, our communities know when they are basically being given free stuff to be able to get their information. And what I mean by free stuff, they know, hey, you want me to sign this paper, you're going to give me a $10, $25 gas card just for showing up so that I can sign your paper. But now this is the Linda Stringfellow concept. We are perpetuating a welfare mindset. That's the way that I look at it, because individuals are coming because they know that they're going to get something. Yes, it does help them make it through that day, but then after that workshop or that session or health fair, now what? I have my gas card, or I have my meal for that day, or I have my Subway gas card, or whatever kind of gift card. Now what? Are they taking the information? Are they even listening? But it has perpetuated a welfare mindset. And we have had, and when I say we, I'm talking about my organization, we've had communities to tell us, okay, I have a 32-inch flat screen TV. I have that in my bathroom. What else do you have to give? So when we started hearing comments of that magnitude, that let us know they're coming just to be able to get something, and it is perpetuating a mindset. And so we've got to start breaking that cycle. And some of the things that we've done is we don't offer gas cards. We started backing away from heavy meals, and we would make sure that it is a nutritional meal if a meal is provided, or we started shortening the length of the time of the sessions that we would have so that people can come in, get the information, which is most valuable, and then be able to leave and go and get something to eat, something of that nature. So we're finding ways, and we're actually going to do an assessment of some of our communities to see, when we offer sessions and activities, what is it that you really see as a true incentive that will benefit you? And that we have had some feedback to tell us, well, I need you to be able to cover my expense to go to the clinic. And we're like, okay, Makes sense. An incentive if we're encouraging you and wanting you to listen to the information and go and get tested, things of that nature. So we're wanting to hear from them because they are who we serve, the communities who we serve. So next. Some of our new approaches, and I mentioned a few, but with our organizations, we are looking at building their capacity. With our organization, what programming are you doing? Is there anyone in the area that's doing the programming you doing? Can you all collaborate? And when we talk about training, if you only have 3 or 4 individuals in your organization and another one has 3 or 4, let's bring those organizations together so that we all can be sitting at the table and getting the same information, and then strategically looking at how we can work together as a region. Because one of the things we really inform them, funders are looking for collaborations and partnerships. They're really not looking at a lot of individual standing organizations. They want to see how people are partnering and cross-collaborating. With our sustainability, if an individual leave your organization, what do you have in place? Do you have job descriptions in place? Do you even have a manual for the organization? And is your funding diversified? If you're getting all of your money from one funding source, as that funding source start decreasing their funding or no longer provides funding, what are you going to do? And we always tell our organizations, including myself, with your services should still be able to move forward no matter who you get your funding from. And then we're looking at new innovative ways pertaining to how we can get the information to our people, how we can get our people to start really looking at health and any other services that they need, and also looking at how it is a responsibility for individuals and families, which also impacts the community. We're looking for those new approaches, and the new approaches, especially in rural areas, do not always mean some type of technology and a new app. It does not always mean that. And also we want to look at re-educating our individuals. Some of us, even myself, we have gotten away from some of the basics that started us down this road or on this path. And now we want to look at how I need to come back to the table and be refreshed. Medical providers come back to the table and be refreshed, as well as people in the community be re-educated about what is new. Because when we talk about HIV and AIDS, years ago, it was quote, quote, supposed to be a death sentence, but no, people are living and people are thriving and moving forward and helping others. But people aren't educated on that part. And then also looking at our smaller organizations, how you're not at a point now, but what are the things that we need to do to help you get situated and stable at this point, and then help you grow so that you can be an independent standing entity. And we always say every tub sits on its own bottom. With our individuals, looking at leadership development, and we're like leadership development, looking at leadership skills. Leadership and management are 2 different things, and we want to make sure they understand the difference between leading people and managing projects and things. And then also getting our grassroots people to look at, we're working with communities, mobilizing the individuals in the community and growing community leaders, which can also, they are there in the communities every day, and they're the ones that can help us get into communities and populations when we are considered a stranger. Even though we're from Mississippi and live in the Delta, we are still strangers in a lot of areas. So we need those community leaders to help us get in the door, and also create learning communities. Excuse me. And once again, individuals doing the knowledge and the prevention and the self-care concept. And the other new approach we're going with is looking at using the asset-based community development concept. We know the negative about our region, we know the negative about our town, and we know the negative about our communities, but no, we want to start changing the perspective and looking at the positive side. What are the assets that we have, and how can we use these assets to help us move forward? And then the other part is bringing us together in a rural development coalition. We no longer want to be poverty poor, and we no longer want to be pimped for our poverty as the Mississippi Delta. We want to start looking at rural development coalitions. We're going to come together and we're going to see how we can work together to move our area forward, and so that we can be our own self-sustaining support. I guess that's the easiest way for me to say it. I think that's it.
Thank you so much, Linda, for sharing all of this rich information. I already identified a few takeaways from your presentation just around access. If there are areas where there isn't a health department or a clinic, or it's only open a few days, how will that impact the health outcomes of the individuals who live there? And you said something so profound around how do you educate the educated. Some really great nuggets I took away from that. We will now hear from Ms. Desiree Dillion, who is also from the state that considers spaghetti and fish, fried fish, as a gourmet meal. So Ms. Desiree, please take the show.
Good morning, all champions. Thank you, Linda, for being my partner in crime in this fabulous webinar. So a little bit about me. I, of course, a native of Mississippi, currently residing in the Dallas-Fort Worth area as a community relations professional. A little bit about educational background. I received a bachelor's degree in business administration and marketing from the University of Southern Mississippi. Also, a master's in management and leadership from Delhaven University. Also received a recent certification in nonprofit governance from the University of Texas in Richmond, Mississippi. I'm getting a notice that I'm having a bad connection here. My apologies. Can you work now? Can you all hear me now? How's the connection now?
Better. It's better.
Better? Connection better? Okay. So I'm giving a little bit about my educational background and the fact that I'm currently residing in the DFW area. So let's proceed to the next slide. My apologies for this connection. How are we doing now? Next slide. Okay. So my most relevant professional experience when I worked in a leadership capacity in the food banking industry. For 12 years, I approved nonprofit organizations that wanted to partner with the food bank industry, which was Mississippi Food Network. That involved an application process, verifying the 501c status of that nonprofit organization, making sure they had a board and they had bylaws, making sure that they had adequate budgets to be a partner of the food bank, adequate funding sources, that they had strong leadership. And I also had to conduct site visits to make sure that there was adequate storage space for them to operate their food pantries and food assistance programs. Also had to make sure that they had adequate staff and their volunteer capacity. A diverse group of nonprofit leaders, ranging from the city of Jackson, Mississippi, all the way to the Mississippi Delta, from currently Dallas, Texas to Paris, Texas. And those communities were a combination of rural communities, urban communities, and suburban communities that all had unique challenges. I worked with organizations that had diverse funding and budgets that range from $200 annually to $2 million annually. Also organizations that provided services, support services to the HIV and AIDS population, to food pantries, shelters, group homes, and daycares that provide services to that population. So in that role, I became an informal consultant because I found that quite a few of those organizations face common challenges. And you'll see to the right of this screen a list of those challenges. Of course, infrastructure. There were, infrastructure deserts in those rural communities, especially in the Mississippi Delta. And we talk about, there may have been, even today, some rural organizations that wanted to log into this webinar, but didn't have the internet capacity to be able to log on. Kind of ironic that I'm got some technology challenges today, but we will move forward. Also, of course, organizational challenges, leadership challenges, not knowing how to plan, not only just from day to day, but from year to year, from 5 years to 10 years. Of course, everybody, has been facing financial and budgeting challenges. Linda mentioned impact and sustainability in her presentation. And of course, making sure that you have the human resources where they are paid staff, volunteers, and a lot of those organizations did not have the funding to pay for staff, so they depended on volunteers to make sure that they were able to provide services on a day-to-day and a consistent basis. The quality of education, the quality of services, whether it was healthcare services, clinics, medical professionals, and of course the local politics play a huge role in terms of what our rural nonprofits face in terms of challenges. Next slide. So out of all of those common challenges that were on the right side of that page, I can identify with the top three in terms of working with those organizations in my informal consultant role. And of course, those were organizational, planning, and financial. And I've broken those top three challenges down into subcategories because I want us to play a little game for the next couple of minutes. And this game and exercise is called I Can Relate, okay? So we want this to be an interactive session, so I hope that you have a notepad or a piece of paper next to you. What I'm going to do is I'm going to give you scenarios of each of these challenges. And I want you on that piece of paper to number your paper from 1 to 9. And I want you to give yourself 1 point if this challenge or this scenario is familiar enough to you in terms of you, number one, currently experiencing that challenge, have experienced that challenge and you've overcome that challenge in the past. You know an organization that's currently going through that challenge or that scenario, or you want to learn more so that you can avoid facing that challenge in the present or the future, okay? So scenario number 1, and this has to do with the board. I am the board chair of my organization and the CEO, and my board members are my family members and church members because they are the only ones that I feel I can trust. Give yourself a point if you can relate to that. Scenario number 2. I am the CEO of my organization. I also pay bills. I hire and fire the staff. I recruit and manage the volunteers. And I drive the mobile health service clinic unit throughout the town to provide services to homebound clients. Scenario number 3. We don't have an organizational chart for our nonprofit. We are small and everyone wears multiple hats. Okay? Now we move on to a set of scenarios that are in the second category of rural challenges. Number 5. I don't have the time to sit down and write out goals and objectives for this organization. As long as we are open and serving the community, we are doing just fine. Scenario number 6. We don't have time to count how many clients we have that have improved their quality of life from our services. We know we're making an impact when we distributed all of our resources. Our shelves are bare, and we have a wait list for services. Number 7, we are so grateful for our 2 major individual donors that have gifted us $25,000 annually for the past 15 years. As long as they continue to provide us with that gift, we are secure. We depend on them. Scenario B for that is, I take money out of my own personal funds to cover additional expenses for our program services. Scenario number 8, our board meetings are so stressful because there's always that one member that finds all of the errors in our financial statements. And our last and final scenario, we are so grateful to receive this $25,000 grant to purchase a mobile health screening unit, but we still have not secured the funding to pay for our driver, fuel costs, and maintenance of the vehicle. Now, everybody take a break. I want you to add up all those points. And if you find that you have a score between 5 and 9, congratulations, and thank you for logging into this webinar, because you've taken the first step in the right direction by, to make sure that you receive the resources and training that you need for maximum mission impact. And as an anchoring nonprofit organization in your community, sometimes we get so focused on serving our neighbors in need that we skip over the very critical steps to ensure that we don't miss out on opportunities to build our capacity. We simply have not prepared for growth, and we have to do the work. So I want to make sure that you understand that these are real scenarios that I've had to consult organizational leaders on, to overcome and give tips on how to make sure that they've addressed these ground zero challenges to be an effective nonprofit organization. Next slide. And so we also get so overwhelmed with these challenges that we really don't know where to start in terms of improving. My recommendation is to start where you are by asking yourself some really important questions. And I've listed those questions in this slide and how you just start the process. If you gave yourself a point for each of those scenarios, start with these questions if your biggest challenge is organizational as it pertains to your board members. Ask yourself, who is on your bus? Are they friends and family? Or are they experts and advocates for your cause in your community? You want your board members to be experts and advocates for your cause, not necessarily your friends and family members, because your board members are the ones that help drive your mission. Okay. You also want to make sure in terms of your leadership, who you have driving the bus of your organization, that they have adequate skill sets, that they know what their management leadership style is, and they're comfortable making decisions, and there's clarity in their roles. You want to make sure that your nonprofit organization has documented policies and procedures and standard operating practices. Even though you are a nonprofit organization, business continuity is very important in terms of your day-to-day and making sure that you are achieving the goals of your organization and adequately serving your clients. In terms of planning, ask yourself if your mission is clearly defined. Do you know who you are, or are you just following the money? Are you trailing and following funding sources that can drift you away from the core mission of the organization? Do you have a strategic plan? Have you shared it with your board? If so, have you shared it with the staff? Is it still relevant? And how are you measuring success and impact of your organization? It's also important to conduct a SWOT analysis. How are you doing? Are you thriving? Are you failing? Are your clients really improving the lives from the services that you're providing? In terms of financial questions and where you start, and I want to reflect back on a point that Linda made. You want to make sure that you have diversified funding. Do you depend on one or two major funding sources for survival? And one of those major funding sources is yourself. As a rural nonprofit organization, you cannot sustain that. You cannot sustain that. In terms of finances and accounting and your budget, do you even know what financial statements are? Are they updated? Can you read and interpret them? Do you have someone on your staff that manages your financial statements and provides those? And are they free of error when you present them to your board? That's very, very, very important. And in terms of your future and sustainability, where will your organization be in 5 years? If you still have a waiting list for those that need services after 5 or 10 years, are you truly making an impact for those clients that you serve? Nonprofits, at the end of the day, are designed to solve a problem. Are you moving the needle in terms of solving that problem, whether it's to make sure that you are providing adequate health screenings for the HIV and AIDS population? Are your numbers still where they were when you started the nonprofit organization? So these are just general questions to ask yourself in terms of starting where you are if you are a rural nonprofit organization. Next slide, please. The final thing that I want to say is you have to, if you are a leader of a nonprofit organization, specifically in the nonprofit sector, I want to encourage you to remain teachable, and I want to encourage you to remain coachable. Even in my role in community engagement and being a consultant, I want to share a resource, and it's called Engine of Impact. And it's the essentials of strategic leadership in the nonprofit sector. It's written by William Meehan and Kim Starkey-Jonker. The foreword is by Jim Collins, which is the famous author of Good to Great and Good to Great in the nonprofit sector. And if you're interested in working with me in doing a work session for this awesome textbook in terms of strategic leadership for the nonprofit sector, I love to do that. So I guess now we're at the point of answering questions. So I give the floor back to Leisha.
Thank you so much, Desiree. Again, both you and Linda have provided us with such rich content this morning. And for our participants, if you have questions, please type them in the chat box and we will try to cover as many questions as possible. So we have had a few questions to come in. And let's see, I was going to try to couple a group of them together, but they are so so broad. So let's take one of our first ones. How do the challenges around resources impact HIV care and prevention? And Linda, I'm going to ask that you answer that question, and Desiree, the next question is going to be for you. Okay?
Okay, can you repeat that one again? I want to make sure I understand all of it.
Sure. The question is, how do the challenges around resources or lack thereof in rural communities, how is that impacting HIV care and prevention?
Okay, I'm gonna try to narrow that down some, the lack of resources and the impact it has on HIV care. Where the first thing is resources is, I would say, access to organizations or even having facilities in the area. Organizations, or rather clinical facilities, function off of funding. So if they're not receiving funding, the less money they receive, the less services they're able to provide. And as far as organizations that are closer in communities, if we don't have strong organizations to be able to even apply for funding, let alone handle the funding, that's another layer of where we're not able to, people are not able to go in and get the services that they need, even that's, whether that's prevention or even testing. So the base, because we really just don't, well, it's not structured, if I'm saying it correct, it's not structured for individuals to be able to provide these services. It's for organizations, whether it's a clinic, CBO, or ASO. So if we can strengthen or find ways to get quality resources to ASOs, CBOs, and medical facilities, and ask them to make sure as they receive them that they do expand it to focus on those with HIV or population, you know, any population that we needed to benefit. So I would answer it that way.
Okay. All right. And Ms. Desiree, you covered a lot of the information in this next question, but how do we increase organizations' capacity in rural areas to have access to funding? And the second part of that question is, as we look at funding, what might be some solutions to help those organizations around sustainability?
Could you repeat the first part?
Sure. So how do we increase an organization's capacity in rural areas to have access to funding? And so I think both of you kind of talked a little bit about, you know, that there are few CBOs there, other entities may be coming in and getting funding on the backs of the poverty of the folks that are in those areas. But how do we increase the capacity of those organizations that are right there in those areas to access funding and then help them be able to sustain their organizations?
Well, when it boils down to funding, it's all about mindset and transitioning from a scarcity mindset into an asset building mindset. And for me, in terms of increasing capacity, it's important for organizations to do some asset mapping and identify who is in that, who are key funders, and what are the key relationships that need to be built locally and regionally. And when I say asset mapping, it's important to identify, for example, you know, who are the key business owners there? You know, rural communities don't have a lot of corporation businesses that can provide funding. However, you know, every business and corporation has a social responsibility, and they give back in some capacity. But if you don't do any type of mapping to know who those key people are and who those resources are, then you miss opportunities. And the most important thing is whether or not those key relationships or the individuals associated with those corporations or businesses, it's important to know whether or not they need to be on your board. And that's where the board comes in. That is where your board can connect you in terms of relationships to those that have access to the funding that can help that organization build capacity, diversify their funding sources. So you got to get out of that scarcity mindset of I don't have, I am a have not. Make a list of those corporations that are local. Make a list of those corporations and businesses that are regional. You can also look to universities that are surrounding those cities and counties. Universities are always doing some type of research, and the research is always linked back to some type of socioeconomic issue in that community. That's always happening. So even though you may not have a resource that could, assist you in terms of funding that's locally, look to your regional universities and colleges that are doing research and have access to funding for you. That's a good way to partner with that university on certain initiatives and be a partner and get access to grants, in terms of, their programs that are addressing those needs. So again, I go back to, in terms of building capacity for funding, start with asset mapping, know who is there locally, regionally, make sure you build relationships with businesses and corporations that could sit on your board and advocate for your needs and help you build that capacity. And look to, universities and colleges that get funding for research for those main issues right there in those communities. Partner with those universities and jump in on funding from that level. So that's my response on that.
Okay. Thank you so much. Our hour has come to an end, and we still have a couple of questions, and we will forward those to you all to respond. At this point, I want to say thank you to our two distinguished panelists. They did a phenomenal job in helping us to look at rural South and some of its challenges, but more important than the challenges, they also provided some solutions. To our participants, thank you for listening and asking questions. This webinar will be available on our website for reference. If you want to learn more about this specific topic or request a training, please apply on our website at www.gileadcompass.com. Tune in next month on Thursday, September 19th for building your nonprofit on a solid financial foundation, understanding the basics. Until next time, have an amazing day, everyone.